As a healthcare professional, you are a trusted resource, and it's your duty to educate and inform your patients, protect the public health, and set an example by getting vaccinated yourself. What you see here is my two grandchildren, Ella and Alder, getting their flu shots right after Brent passed. My lovely office staff put these posters up in every room telling my son's story. And that year, they ran out of flu vaccine quickly. This is a trusted resource. Always educate, share your own story about getting vaccinated, share your someone else's story, share one of Family Fighting Flu's family's stories. Research has shown that when we as healthcare providers give stronger recommendations, adults are more likely to be motivated to get vaccinated. In fact, a strong recommendation from a healthcare provider increases the likelihood of patients getting vaccinated by 61%. All right, let's talk about motivational interviewing. Uh, Motivational interviewing is a evidence-based and culturally sensitive way to speak with unvaccinated patients about getting vaccinated and can be used actually for a lot of things in healthcare, and it is very, very effective. The goal is to help people manage mixed feelings and move towards healthy behavior, change consistent with their values and needs. It's ideal for situations for concerned patients or parents um, with questions. And using MI with vaccination decisions demonstrate increased intent to vaccinate and improve vaccination rates. There are four steps uh, to this technique. One is being empathetic. Two is asking permission to discuss. Three is applying interviewing techniques such as reflective listening. And four is responding to questions. Let's go through an example. Step one, being an empathetic partner. Be compassionate and show empathy. Be sensitive to culture, family dynamics, and circumstances that may influence how patients view vaccinations. Do not argue, do not debate. Ask permission to discuss vaccinations. Start by asking permission to discuss. And for example, if it is okay with you, I would like to spend a few minutes talking about vaccinations and your family. If the patient indicates they don't want to talk about vaccines, probe a little bit. For example, can you tell me more about the reasons you don't want to discuss vaccination today? And be respectful of the patient's decisions. If you're not ready to talk about vaccines today, that's okay. Ask if they would be willing to talk about it at their next visit. For example, because I care about you and your overall health, maybe we could talk about vaccinations the next time you come in. Ask open-ended questions. Avoid anything with a yes or no answer. Affirm positive behaviors. For example, that's great, you've gotten your flu vaccine. Now let's discuss some other vaccinations and reflect on what you hear. It sounds like you have questions. Summarize the conversation. This is called reflective listening. Very powerful. People just want to know they're being listened to. And by using reflective listening, you let them know you heard them. And so, for example, let me see if I understand what you've said so far and summarize the conversation that that happened. Then ask patient use a scale question. For example, on a scale of 1 to 10, how likely are you to get a flu shot today? And explore their answer. You know, uh, why did you choose this number? Why wasn't it lower? Why wasn't it higher? What would it take to get you to a higher number? The goal is to help the patient become more open to moving towards higher numbers and I get vaccinated. If a patient asks a question about vaccine safety, vaccine risks, or their health or mental health, respond within the boundaries of your competence, ethics, and scope of practice. Most data on safety and risk is population-based. Practice framing safety as an individual risk. Based on your health, you are at increased risk of getting very sick and in the group that vaccines will most be beneficial. If you don't know the answer to a question, discuss how to find a good source of information.